Tuberculosis is a disease caused by Microbacterium tuberculosis, and this disease affects humans of all age worldwide globally. But this disease is more common in sub-Saharan Africa, some northern part of the American and Asia. This disease causes a huge loss to humankind. Tuberculosis is an airborne disease caused by the bacterium Mycobacterium tuberculosis. Tuberculosis and 7 very close related mycobacteria species are also found, and this includes Mycobacterium boviei, Mycobacterium africanum, and all that. Together, they all form what is known as tuberculosis complex. Although most of them, of this species, do not affect humans. Okay, so that's one thing about this tuberculosis. Mycotuberculosis is carried in airborne particles called droplet nuclei of about 1 to 5 microns in diameter. Infectious droplet nuclei are generated when persons who have pulmonary or laryngeal tuberculosis disease cough, sneeze, shout, or sing. Depending on the environment, these tiny particles can remain suspended in the air for several hours. Microtuberculosis is transmitted through the air and not by surface contact. Transmission occurs when a person inhales droplet nuclei containing Microbacterium tuberculosis, and the droplet nuclei transverse the mouth or nasal passage to the upper respiratory tract down to the lower respiratory structures. You might wonder why this tuberculosis chose to live in the respiratory structure. It is because it is a strict aerobic bacteria. That is, it loves oxygen, okay, and it lives more in the alveolar part of the lungs. Because this microorganism loves oxygen, it tends to reside in the alveoli. And if you look at the screen, you will see how this disease is transmitted through airborne, through droplet nuclei. And this nuclei, like we said earlier, can be suspended in the air current for a longer time before it gets into the respiratory tract. Diagnosis. This disease can be diagnosed clinically through the clinical manifestations. 1. Cough longer than 2 weeks. 2. Coughing up blood or hemoptysis. 3. Fever. 4. Night sweats. 5. Weight loss. 6. Loss of appetite. These are some of the clinical manifestations. Outside clinical diagnosis, we can perform chest x-rays, and this usually reveals cavitation on the chest radiograph, and this cavitation is as a result of secondary TB. Then other laboratory investigations include positive culture for mycotuberculosis bacteria, then positive acute acid-fast bacillus sputum results, and GNS-PAT test. GNS-PAT test will detect if the TB is drug sensitive or drug resistant. Now let's talk about classification of TBs. TB can be classified into 2: pulmonary TB, that is the TB that occurs primarily in the lungs, and extrapulmonary TB, that is TB that affects other organs of the body, such as the larynx, the lymph node, the pleura, the brain, the kidneys, bones, and joints of the body. Is known as extrapulmonary TB. Now let's look at stages of TB. TB has different stages. We'll first of all look at the primary TB, then secondary TB, and miliary TB. The primary TB is also known as the latent tuberculosis infection. Okay, so persons with latent tuberculosis infection has the infections but do not manifest the disease. Okay, a person with this stage of TB is regarded as having a case of TB. The process of latent tuberculosis begins when extracellular bacilli are injected by macrophages and presented to other white blood cells. This triggers the immune response, in which white blood cells kill or encapsulate most of the bacilli, leading to formation of granuloma. At this point, the latent TB has been what? Established. Latent TB may be detected by using the tuberculin skin test. You might be wondering, how does this really happen? Looking at this diagram on the screen, it explains better. When someone contracts the bacilli of the tuberculosis, the immune system immediately sweep into action, and the immune system, the macrophage, engulf this bacilli. And when they engulf this bacilli, normally the macrophage will kill that bacteria or invader through a process involving the lysosome and the phagosome. And the lysosome, once the lysosome fuses with the phagosome, they both destroy that particular microorganism. But however, in the case of tuberculosis, it's not the same way. The tuberculosis has a way of preventing the friction between the phagosome and the lysosome. This makes the TB to evade the destruction by these two organelles, thus allowing the bacilli to multiply in the macrophage. However, as this multiplication continues, other immune cells are sensitized, and as they are sensitized, they tend to infiltrate and form a, a seal around that macrophage that have swallowed that bacilli. This leading to formation of the granuloma. This microorganism of the TB that is inside the granuloma is active but cannot cause any infection because it's still inside the phagocyte and cannot, unless it breaks away from the phagocyte, it cannot cause any symptom. Like I said in the beginning of the lecture, the bacilli loves air and it resides in the alveoli. Looking at the diagram, you find that it stays in the alveoli. So when they are now formed, when they have formed this granuloma, they becomes inactive, and we say that we have latent TB. At that point, the person is sensitive to the Mantoux test. Okay. Now, why white blood cell form around this granuloma? It keeps it inactive, and once the immune system is active, it will not affect the person, and there will not be any sign. And this thing it forms is known as the Ghon complex. Now let's talk about the secondary stage of the TB. At this point, the granuloma breaks, maybe for many other reasons that the immune system is no longer able to keeping the infection in the granuloma. Let's say due to malnutrition or other co-infections that lower the immunity. This is mostly seen in adults as a result of reactivation of previous infection or reinfection with a new strain of TB, particularly when the health status decline. Okay, so this is the cause of this secondary TB, and now the person will begin to produce the signs and symptoms of TB, and the person is very, very, very infectious. So the secondary TB is a result of immune system lowered or reinfection by another strain of TB, or and the breakage of the granuloma. Looking at our diagram, you find out that the red rod TB has broken the granuloma, and it can now start attacking the tissues of the lungs and the general body, and the patient will begin now to produce signs and symptoms of pulmonary TB. And one thing about this pulmonary TB is the formation of cavitations, okay, that is seen on the radiograph. The next is miliary TB, and miliary TB occurs when these bacilli have entered the bloodstream, and it can now disseminate and affect other parts of the body like the kidney, the brain, and other tissues of the body. If it affects the heart, it can lead to pericarditis. If it affects the adrenal gland, it leads to Addison disease. If it attacks the liver, it can lead to hepatitis and many other organs. So even the joint and the spine can lead to spine. Classification of TB. TB is classified based on response to anti-tuberculosis drugs, under which we have drug-sensitive TB, that is the TB that the drugs can actually treat or respond well with a standard combination first-line treatment, and the drug-resistant TB. And this drug-resistant TB can be in form of multi-drug resistant TB that resist the isoniazid and the rifampicin, or extensive drug resistant TB that resist all the first line drugs and the second line drugs. TB treatment occurs in two phases. The first 2 months of intensive treatment, and then 4 months follows using four combination of drugs. So the following drugs are discussed. One, isoniazid. Isoniazid, even though effective, produces peripheral neuropathy and optic neuritis by killing the enzyme that forms vitamin B6. Ethambutol produces optic nerve damages. Then rifampicin produces reddish urine and can cause hepatic damage and also enzyme induction, which is the major reason it can cause adverse drug reactions. Parazinamide, this drug causes impairment of the liver function and hyperuricemia. Streptomycin, this drug is notable for causing damages to the inner ear, librams, and minor nephrotoxicity that affects the kidney. The pyridoxine is a supplement that is given to reduce the toxicity of isoniazid, because we know that isoniazid produces peripheral neuropathy and optic neuritis by killing the enzyme that forms vitamin B6. So therefore, TB patients can't produce their own vitamin B6. Although these drugs are effective and can kill the bacteria, but these are their side effects. Second line drugs includes fluoroquinolones. That is, if the first line fails, you use fluoroquinolones, kanamycin, amikacin, cryptomycin, and clarithromycin. These are the second line of drugs used for resistant TBs. Drug resistant tuberculosis. This can be multi-drug resistant tuberculosis which is resistant to isoniazid and rifampicin. It can also be in form of extensively drug resistance, which is resistant to isoniazid and rifampicin and other second line agents. This resistance usually occurs if the patient fails to comply with the drug, or there is out of stock syndrome, or uh, the patient is not following the regimen as it's expected to be, and this will lead to drug resistance, especially in the intensive phase. That is why after 2 months of the intensive phase, the patient is sent for gen expert examination to ascertain if the person is still infectious, or if the the TB is now resistant to those drugs. Newer drugs includes this one you can see on your screen right now. Prevention of TB can occur in three levels: primordial prevention, primary prevention, secondary prevention, tertiary prevention, and quaternary prevention. In primordial prevention, our aim is to prevent the person from being at risk for TB. Let the person never have any risk that will allow the person get the disease. And this includes good governance. When government builds good houses, provides a lot of good accommodation for people, the people in the prisons will be decongested, and this reduce the exposure to risk. The policy formations that will enhance good and better life, control measures in place against TB using the National Tuberculosis and Leprosy Control Programs, international collaboration, research, campaigns, and other NGO activity to stop TB. At this primordial level, the infection have not occurred. In fact, the person that doesn't have the risk of developing the disease, not even contracting the bacilli. So the prevention level at this level aims at preventing you from not being at risk, so that you will not be at risk for this particular disease. And this particularly involves good governance, when the government builds good houses and structures, good policy formations, good and standard and resilient healthcare that ensures control of these diseases, and international collaboration and research. So primordial preventions prevent you from being at risk for the disease. In primary prevention level, this person is already exposed to the risk. Let's say someone in his household is already having the TB, or the person works in a hospital where TB is being managed, or the person is already exposed to the TB. So what you do now is to make sure that the person does not come down with the illness, and this includes general health promotion, so that good nutrition, the person takes good nutrition to boost the immunity, drug use, sanitation, that's keeping their house cool, housing, health seeking behaviors, then immunization against TB using BCG. All children are at risk and in all endemic countries. Then chemoprophylaxis using as preventive therapy for persons with low immunity, especially those who have HIV. They are already at risk of contracting this infection. Infants are also at risk. So primary prevention aims at preventing them from coming down with the disease. Okay, whereas primordial prevention prevent them from being at risk at the first place. But in primary prevention, they are already at risk, but you not prevent them from coming down with the what illness. In secondary level of prevention, the patient is already having the disease. What do you now do? You now limit the extent the damage of the disease would cause to the person. And this includes early diagnosis and treatment, then case finding, especially among close contacts, then disease notification and surveillance. So these are activities to carry out. Already the person have the disease already, but you have to limit the spread of the disease from being or entering into epidemic. Then the person that already have the disease, you need to identify the person early, treat them with the treatment so that the disease can go. And the treatment approach is known as the DOTS approach. Tertiary level of prevention. Under this level, we try to limit the disability and rehabilitate the person. The person have already suffered the TB, and this TB may have caused the person long having issues, and this will affect the type of work the person will involve. So it require vocational rehabilitation that the person can now be doing the work that someone who has a lung damage can should do. Are you getting me? Then also stigmatization. We have to prevent stigmatization at this point, rehabilitate the people, the patients involved in aspect of vocational, social, medical, and psychological. So in tertiary level, we try to limit the disability and we now try to rehabilitate the person depending on the impact of the disease on the person's physical, mental, and social health. Quaternary level of prevention. At this level, we try to limit over investigation and over treatment. We know that these patients are already having a lot of disease condition. We try to reduce the over medicalization, understanding that drugs have adverse effects and these people can suffer from adverse effects. So we try to reduce the adverse effect of drugs and over medicalization and over investigations. Try to make the pill easy for them to take. Thank you.